Welcome back. If you're just joining us, this is Breakfast Daily, and right now we are getting into our health segment. And as we start the year, it's actually very important for us to start it with awareness and empowerment, because it's all about the Cervical Cancer Awareness Month. And throughout this month, we are going to be knowing the facts, hearing the resilient stories, and all the information that we need to know about cervical cancer. And joining us in the studio is Dr. Kalsum Zakaria Adam, public health practitioner and national coordinator of MWIA of MWAG.
Yes.
MWAG.
Yes.
That's a lot.
Yes, that's
How are you?
Very well.
So it's interesting. You said she's joining us in the studio.
Yes.
But we are joining her in her consulting room.
Wow, that's true. Hi, Doc.
Hello.
Okay, so we're
Good to see
here.
you.
Thank you. Happy
Welcome.
New Year.
Happy New Year
It's
to
been
you
long
too.
since
Yeah,
we're
it
in
has.
your consulting room. You know, today we just want to know more about the Cervical Cancer Awareness Month. I'm a very good actress. Cervical Cancer Awareness Month.
All right, fantastic. That's nice. Welcome.
But you know
And,
all those adjectives that the acronyms.
Yes.
There are a lot of them. What does it even mean?
Yeah, it's always a lot, actually. Okay, so let me make it simple. So MWAG, which is MWAG, is Medical Women Association of Ghana.
Right.
And then YMWIA is Young Medical Women International Association. So MWAC is under MWIA.
Okay.
So that's the international body. Yeah.
Fantastic.
That's interesting.
Well,
So Medical Women Association of Ghana is basically an association of all lady doctors across the country,
Right.
coming together to talk about issues, coming together to advocate about pertinent health problems, and then, yes, to see the way forward, and then also help in our own little way in impacting lives.
Right,
So basically,
right,
that's what we do.
That's nice.
so impacting lives, cervical cancer. We're
Yeah,
here.
cervical cancer.
Every year we talk about this.
Yeah.
What is it, and where are we in terms of the awareness? How aware are we as a Ghanaian population?
All right, so what I would say is that cervical cancer, let's take it simply. Cervical cancer is from two words, cervical and then cancer. So cervical is from the cervix, and the cervix is actually the mouth to the womb. So that's little area there. It shuts when you are actually pregnant to keep the baby within the uterus, and then it opens very wide for you to be able to expel the baby out whilst in labor. Yes. So when you have changes, you have changes within the cells, molecular changes within the cells that lead to uncontrollable division of these cells, such that they tend to become diseased, and then they travel to other areas of the body. Then we say that we have something called cervical cancer. So in terms of awareness, I would say that yes, MWAC has been doing this for a very long time now. I would say over 10 years. Yes, and in January, we always raise the awareness. We always tell people about cervical cancer, because cervical cancer is one of the very highly preventable cancers in women. And just by lack of knowledge, a lot of people end up losing their lives from it. So why do we wait till we lose our lives from something that we can prevent, something that we can easily, is one of the cancers that you can easily prevent. So it is important that we talk about it in January, in fact, throughout the year, but at least the highlights are in January, so that we raise more awareness, let people know about it, and then people are put on particular screening schedules to help them to catch the disease very early, because it's very important.
Yeah, you talked about, it's being preventable. So before we get to the risks, how can we prevent it?
Okay, so there are certain, so we need to talk about the etiology. That is what causes cervical cancer. Literature has said that about 70 to 90% of cervical cancer is caused by, HPV, which is human papilloma virus, and it is a sexually transmitted disease. day in and day out, everybody gets infected with HPV. There are various strains, but then it depends on your immunity. And usually you will be able to clear the infection without it staying on for a very long time to start to cause these cancerous changes. But when there are certain favorable conditions and then you are unable to clear this infection, it stays on and then starts to cause changes within the DNA of the cells of the cervix. And then eventually it becomes precancerous lesions, dysplastic changes, and then eventually it becomes full-blown cancer. And the thing is that it gives us a window of about 10 to 15 years for all of these changes to happen. So within this window, if you are doing your regular screenings, you should be able to catch it within the precancerous lesion stage. And then eventually you're able to curb it or stop it so that it doesn't progress to become full-blown cancer. So that is why we keep telling people cervical cancer, unlike breast cancer, is something that we know that it has an association with HPV, which is sexually transmitted. Okay, so once we know that it is associated with HPV, we should do our regular screenings such that we will be able to catch it.
What are your typical risk factors? And then again, if you can also just talk about the signs and symptoms.
Okay.
Yeah.
All right, so some of the risk factors are, as I said, HPV, sexually transmitted. So having multiple sexual partners or having partners who have multiple sexual partners. Well, that you wouldn't be able to have control over that. Yes. And then another would be that our regular lifestyles, that's smoking, which is regular for all cancers. Smoking, the rate of smoking, alcohol use, and then sometimes when you tend to have as I mentioned, the multiple sexual partners, which is very key, and then other not taking good care of yourself, not eating properly, and all of that. So all of these are certain risk factors that can predispose you to getting cervical cancer. Another could be the having sexual interactions at a very early age, so early coitus. So imagine we have somebody who is who started having sexual interactions at about age 15, and the person is now 40 years, as opposed to somebody who started having sexual interactions at about age 20 and is also now 40 years. So if you look at 15 to 40, that's about 25 years, as opposed to 20 years. So it means that if the person is being exposed to the HPV, the person who had the 25 years has a higher risk of developing cervical cancer, as opposed to the other person who
are
had
both
just
40.
Exactly. So early coitus is one of the main risk factors of having cervical cancer. And you spoke about signs and symptoms. Yes. Actually, what we want to drum into people's ears is the fact that early stages of cervical cancer or the precancerous lesions do not have any symptoms at all. And that's the danger of it. Because a lot of us Ghanaians would want to wait until we have some pain somewhere or there's some discharge somewhere before we want to go and then seek the doctor's advice. You get it? And that is the dangerous part of it. Because if we are looking at that window, that 15-year window, it means that you wouldn't have any symptoms at all. And it's important that you take control over your health and then have screening so that at those early stages, you can catch it early. But if the cancer does happen, yes, there are some symptoms. And the symptoms could be that you can have some foul discharge, foul smelly discharge from the vagina. You could have bleeding, intermenstrual bleeding. You can have painful sex, very painful sex, lower abdominal pain, and then bleeding right after sex. You get it? So all of these are some of the signs of cervical cancer. And depending on the stage, because it can metastasize, it can travel to other parts of your body. Depending on the stage, you tend to have other symptoms related to particular systems. So if it travels to your chest, you may end up coughing.
So we can see something on the screen there. You want to walk us through what we're looking at?
Okay, all right, sure. So this is just showing, so the picture to my left is showing the female reproductive organ. Okay, so you can see the vagina. You can see the cervix, that's a small area there, which is protruding into the vagina, as you can see. And then you have the uterus and you have your fallopian tubes on either side connected to your ovaries. You get to, so looking at the anatomy of the female reproductive organ, you notice that the cervix is actually protruding within the vagina. So anytime there is sexual intercourse, it is the area that is exposed exactly to the HPV, which can be picked up. And this particular picture also shows different stages of the cervical cancer. Okay, so once you have cervical cancer and it is diagnosed, you need to stage it. And there are various stages. We have stage 1, 2, 3, and then we also have some sub stages. The essence of this picture is to tell us the different stages that cervical cancer can come in. And this is, it's important you are able to stage it because it helps with telling you the prognosis or the outcome of the disease, which would also define the treatments that you give, because there are different treatment modalities that you can give based on the stage. So this is just to show you cervical cancer and the different stages. And this is showing the early stages, which is stage 1, and then yes, I can see stage 1A and then B there, which is showing some early stages and then advanced stages.
So what are some of the treatments available for it?
So treatments available for cervical cancer, it depends on the stage. We have surgery, we have chemotherapy, we have radiotherapy. We can have combination of any of these three. And then in very advanced stages, you may not have any treatment at all, but rather you'd want to nurse the patient and then alleviate any pain that the patient has. And then so that you make the life of the patient a little bearable until they pass on, and that is what we call palliative care. So depending on the stage, you would be able to give a particular treatment.
So as Medical Women's Association of Ghana, what are some of the activities you're embarking on this month? Just wrap it up for us.
Okay, so what we are doing this month as Medical Women Association is that we are going, as you have given us a platform here, to talk about cervical cancer, to let people know about cervical cancer. We are using various social media platforms as well to educate people about it, because it's important that, I mean, one of the main things is prevention, and the preventive, one of the main ways to prevent is to be able to screen. Okay, that's a secondary prevention. So screening, and we are telling people about the screening, the different screening modalities that are available, which is VIA, pap smears, and then all of that. And we are also partnering with Lexter Ghana, the producers of gas. Usually they help us to, I mean, reach to other areas, non-reachable areas, to be able to let people be able to be screened for some of these cancers. So VIA, so this year we will be launching the whole Cervical Cancer Awareness Month in the Northern region. Usually we do it in Accra, but this year we are going to the Northern region on the 20th. So I'm sure a lot of people will benefit from that. There will be educational talks as well as some free VIAs that will be done for the people in the Northern region, as well as other medical women in various regions would also have these little talks and then provide the services, free screenings as well.
Right, thank you. Thank you so much, Dr. Carlton.
You need to come back again and do some demonstrations for us.
Yeah, definitely. I will be back. You would actually be seeing me here throughout the month of January.
Super.
All right.
Like
okay, thank you so much. Thank you so much. Anyway, viewers, we've been talking about the Cervical Cancer Awareness Month, and like she said, she is going to be taking us throughout the month on, knowing the facts, hearing the stories, and all informations that we need to know about it. So we've been talking to Dr. Kalsum Zakaria Adam, public health practitioner and national coordinator of YMWIA of MWAG. Yes, MWAG. All right.